Thank you so much, Professor Gobina. Firstly, I want to thank your kind invitation and good evening, all friends from India. Firstly, I want to share, I have a beautiful links with India. The first thing is when I was young, there are a lot of people always say I looks like an Indian, but that is happened when I was young. And the second thing is in 2009, the two doctors I studied with Cameron Izad in Stanford University of US. The two doctors are Indian. One of them, whose name is Sumati Kutikila. She is treat me so nice, and he helped me to find a place to live. So I remember it forever. So also, she always take us to see and to enjoy different culture, including the Indian cuisine, Indian food. I love it. I feel Indian food is very delicious. And the third, the link is here. So from this picture, we can see the several doctors here. So maybe before the pandemic, several years ago, due to the conflict in my schedule, I was not able to see them, but I arranged this visiting. So they leave the pictures to my colleague. They are from, I'm not sure whether these three handsome boy, today in this webinar or not, Professor Gobina, the three doctors from India. So today my topic is about adenomyosis treatment. So first, adenomyosis, all we know, it's a very hardest disease. Also, like Professor Gobina mentioned, it's enigma. So the three hard things, one is complex pathogenesis. The first case was found in 1816 by Rocky Tansky. So it already coming through more than 1 century and a half, but we still do not know what is the true reason about adenomyosis. The second hard thing is very difficult to treat, except hysterectomy, especially related with IVF. Like Professor Gobina said, it's really a very difficult disease. The third hard thing is high recurrent. And this disease, the incidence is much higher than we know. Like yesterday I talked about with Professor Gobina, the incidence much higher than in the data in the magazine. The patients is getting younger. So here we can see the patients only 16 years old, unmarried girl presented to us with acute episodic pain in the left lower abdomen. The pain was severe in nature and occurred every 2 or 3 months for last 3 years. So now the young girls already have menstruation at their very young age, sometimes less than 12 years old. Like this girl, 16 years old, already had 3 years pain, so she has his menarche at 13 years. Her menstrual cycle were regular with an average flow. He had severe dysmenorrhea. She required analgesic for pain relief. She had already undergone ultrasound and MRI. Here we can see the MRI, the endometriotic lesion. And from 3D ultrasound can clearly see the lesions here. And through laparoscopy, so we can see the lesions here. So the mechanism about adenomyosis are also very complicated. So this is from Professor Chaperon, who is the president of Endometriosis Society in the up-to-date. And he mentioned in his slide, uterine construction and the hyperperistalsis cause the efflux of endometrium into the peritoneal cavity and contribute to implantation of endometrial tissue and the formation of endometrium lesion at ectopic site, resulting the development of three common types, SUP, OMA, and some DIE. Part of the rectovaginal DIE is derived from the metaplasia or Mullerian remnant. Extrinsic adenomyosis may arise secondarily through pelvic adenomyosis. Here he mentioned a very interesting type, FAOM, focal adenomyosis outer myometrium, can result from rectal and bladder DIE. Evidence suggests that SUP, OMA, and extrinsic adenomyosis occur in relatively young women and show TGF-dependent fibrosis. The RETRAR and the EMID hypothesis show uterine construction also induced microtrauma at the EMI, leading to intrinsic adenomyosis with time. So the two types are coming from two different mechanisms. Intrinsic adenomyosis is frequently found in women in the transitional period of menopause and show TGF-independent fibrosis. The mechanism of fibrogenesis may differ depending on the site of the lesion and the time course. So this is a new one. And I want to mention that the very close relationship between IVF and adenomyosis. There are so many guidelines and data and investigation, so they had a close relationship. Especially from Chaperon's new paper here, focus adenomyosis is significantly and dependently associated with infertility, especially primary infertility. About adenomyosis management, very important thing is depending on patient's intention and priority. Second is clinical symptoms include AOB and pelvic pain. The patients come to us, the big reason is pain. The second is anemia. And third is infertility. Adenomyosis phenotype, infertility history or desire of pregnancy, also very important. Associated endometriosis, nearly 50% of adenomyosis associated with SUP, OMA, DIE, or endometrial polyp. Associated other disease like polyp, myoma, some kind of pound coin classification. So here's a clue for our treatment. AOB and adenomyosis. Here we focus on infertility. If the patient have very severe anemia, the first thing should inhibit menstruation and improve hemoglobin. If not spontaneously pregnant, we should seek the help from the doctors, like part of you may be the reproductive doctors doing to help the patient pregnant very soon. The HIFU after 2 ART failure can be choice definitely. And if the patient have no severe anemia, usually we will depending on the desiration for pregnancy. If the patient without the desiration, we will choose the size of the lesion. If the lesion larger than 3 centimeters, we will begin 3-step therapy, HIFU, medical treatment, and TCRE plus Mirena. If the patient, the lesion less than 3 centimeters, we can directly go to TCRE and the Mirena. So here, I want to say all roads leads to Rome. So we can choose any kind of medication. Dynogest is a very new oral medication for adenomyosis. So this is our cases. This patient wouldn't like to choose any kind of operation, even HIFU. So she would like to accept the medication. So very important thing, you should follow the patient's psychologically motivation. After 8 months, we can see posterior endometriotic lesion smaller, shrink more, and the patients relieve the pain. And we have many patients with big cyst, OMA, chocolate cyst. So usually this kind of patient, we will combine with laparoscopic surgery. Also, sometimes if the patient has polyp or submucous myoma, we also combined with hysteroscopic surgery. So about the big chocolate cyst, we will choose 4 steps for laparoscopic skill. The first thing, absorb the liquid completely. And the second, do hydrodissection. Hydrodissection technique we learned from our professor from Stanford University, Cameron Nizat professor. He liked to everything hydrodix, put water inside, even the very small cysts, very small peritoneal endometriosis. He good at to use this technique. And the third step, drilling the very gently to protect the normal tissue, normal ovary tissue. The first step is coagulate gently. For the very big lesion, for diffuse adenomyosis, usually we choose these 3 steps. We already mentioned this many times. I guess some of the doctor already heard it before. Step by step, first is HIFU and then use GnRH or any types of medication. And third step is Marina. So we published this paper in 2019. So we had at that time we concluded nearly 200, more than 200 patients. From this picture, we can see posterior adenomyosis. 1 day after HIFU, we can see the ablation area. And only 80 days after HIFU, we can see the beautiful size of the uterus. So we surprised with the beauty of this non-invasive HIFU technique. So I wrote this sentence, as magical as a work of art. The normal uterus inside the pelvic wall is like turnip, the beautiful flower, and the uterus size can be changed if the lesion disappear, including myoma. So we compare the patients through VAS score. Here we can see after HIFU 3 months, 6 months, 12 months, the C1 to 5 level and the VAS score, the very getting the good level. Also the menstrual volume score decreased dramatically, including uterine volume. We can see here just after 3 months, like the case I mentioned, only 18 days coming to the normal size. 3 months, 6 months, and 12 months, the uterine volume was compared before after HIFU treatment. The uterine volume was significantly reduced after HIFU ablation. Hemoglobin level also increased dramatically. The very standard traditional CA125 also can dramatically reduce the just after HIFU. It's like magic. So our conclusion about these 3 steps, it has safe and effective and efficient. It can improve the quality of life of the patient, especially with the patient localized adenomyosis. Here I want to share some specific cases. These patients, 41 years old, she has 19 years of progressive dysmenorrhea, very typical symptom, and the menorrhagia more than 7 years. BES score 7 to 8, and also like to 3 months pregnant, and the hemoglobin 94, C125 278, anterior uterus, the lesion size 76 millimeter, posterior wall, we can see here, posterior wall and adenomyotic lesion. The treatment plan is GnRH, HIFU, Dynagels, and TCRE, and Marina. Actually, this patient had 5-time injection in another hospital already. So we follow this treatment curve that give the HIFU in 2020, the April, and after HIFU, the patient wouldn't like accept the GnRH again because she had many side effects. So she want to choose the oral medication, Dynagels. And then nearly after 1 year, the size of the uterus nearly coming normal. So we give the TCRE, shaving all the endometrium out and put Marina in. Here is the picture. So before HIFU, we can see the posterior adenomyotic lesions, and after HIFU, we can see the ablation area. This is a TCRE video for very easy. So I saw you are all good surgeon to laparoscopic and the hysteroscopic surgery, shaving the old endometrium out. And now the patient have no menstruation and she feel happy. So our proposed treatment protocol combined HIFU medication and TCRE and Marina for the patient without pregnancy desiration. So that is combination therapy. HIFU also will not influence the ovary reserve. The pregnancy outcome of endometriosis patients treated with HIFU, the effect is good. Here is a paper published by one of our very famous professor in China, 78 patients. And this is a retrospective observational study. In our center, we have more than 50% patients with adenomyosis. Here we can see the patient's age less than 14, nearly half, more than half. And we already have nearly 100 people pregnant, 19th IVF, because this patient already had planned in the IVF center. So we have very nice cooperation with IVF center, also with obstetric department. We cooperate together. So we finish the HIFU, we send the patient back to the IVF center. So we have several cases, filled several times in IVF center after HIFU treatment and easily pregnant. The first time get successful result. And we have another patient, they want to naturally pregnancy and all the results are good. There are no rupture. There are no uterine rupture happen. So this is a patient, cases the pregnant, 38 years old, 6 years progressive dysmenorrhea, the lesion size nearly 5 centimeter posterior wall. Treatment plan, embryo frozen first. So this is a very important. We should discuss with IVF doctors and patient and family. Frozen embryo first and do HIFU, and then give GnRH and then IVF. The pregnancy outcome is very good. No obstetric complication, full-term cesarean section, but it will depending on the obstetrician and patient situation. It will not related with HIFU surgery. So here we can see the patient's procedure clearly, embryo frozen and then HIFU, and we give 3 injections. Actually, the patient had normal size of uterus after 3 months. Because of the family reason, the patient get pregnant 1 year later. So here we can see the posterior adenomyosis, the lesion, the ablation area. From the last picture, we can see endometrial line is beautifully recovered. So very important thing, the HIFU can improve the endometrial environment. The environment is very important for IVF. So our summary, effective treatment of symptomatic adenomyosis require classification of the disease. Adenomyosis negatively impact fertility and obstetric outcome. Surgical myomectomy has a risk of surgical complications that may lead to obstetric risk. So I have colleagues who do laparoscopically surgery. The patient's happened rupture at her 32 months. The baby died. That is really sad story. And it also happened in another hospital. I heard the 8 cases in 1 year. But our HIFU never happened rupture. HIFU has the advantage of non-invasive, favorable safety profile, quick recovery, and retreat capability. So adenomyosis is a very complicated disease, also the chronic disease uncurable. So we will not expect after HIFU stop any treatment. The lesion will come back again. So we should tell the patient before HIFU. After HIFU, we will continue to control the lesion up to the menopause. Like a pelvic vampire, no menopause, no menstruation, no adenomyosis. We should waiting for the menopause. So HIFU can selectively ablate the concentrated granular muscular lesion, reduce the scope of the lesion, and abrogate the function of the ectopic endometrium so as to improve the symptoms such as dysmenorrhea, heavy menstruation, and the uterine environments. That is very important to IVF. A combination approach, HIFU and medication, is required for the effective management of adenomyosis. HIFU may be particularly suited for patients with pregnancy desire, but require more clinical study. We are doing study now. And like Professor Gobina mentioned, I am beginning my career with laparotomy, open surgery. And from 2000, I begin my laparoscopic journey. And from 2015, I am still young for HIFU surgery. Actually, our cases just more than 2,000. But in some center, that is 20,000 maybe in Sweden and somewhere. But our cases focus on adenomyosis. So I have many excellent teachers like Cameron Nizat, Peter Ma, Felix Wang. All they are famous in the laparoscopic area. And in China, we have very different medical system. We usually work in the public hospital, everything controlled with the government. We seldom go to private hospital, or we can't have established our private center. So we should depending on teamwork. We should build a team, can develop any tactic growing healthily. So I have my team here. Totally, we have 5 doctors can performing HIFU. And I also had 2 doctors follow me doing laparoscopic surgery. And this is the autumn season here. So I want to show my hometown, Xinjiang. I'm in Shanghai, Xinjiang in the western part, the beautiful autumn landscape. I hope after this discussing pandemic, welcome to visit my hometown. And I also want to say the thanks to Professor Gobina again. Thanks for your invitation. And I check a little bit thing today to learn some culture about the India. I want to end my lecture with these words that is from your very famous writer. When we help others, the universe will help us back. Thanks again. All the best for all of you.